How to survive a heart attack. 5 urgent steps that could save your life. Imagine this, you're sitting at home watching TV, or maybe you're out running errands. Suddenly you feel a strange pressure in your chest. It's not exactly pain at first, more like tightness, as if someone were pressing down on your chest with both hands. You try to brush it off. Maybe it's just indigestion or anxiety. But then, the sensation intensifies. A sharp pain spreads to your left arm, your neck, and your jaw. You feel dizzy, short of breath, and sweat drips down your forehead. You're having a heart attack. At this moment, every second counts. The decisions you make in the next few minutes could mean the difference between life and death. Yet, many people don't know what to do, and that uncertainty costs lives. Today, we're going to break it down for you. These 5 urgent steps can save your life if you ever find yourself in this terrifying situation. Even if you think you're perfectly healthy, this information is critical, because heart attacks can strike without warning. Stay with me until the end, because I'll also be sharing key prevention tips to help you reduce your risk of ever facing this scenario. Let's get started. Step number 1, recognizing the symptoms, the first and most crucial minutes. Many people ignore the early signs of a heart attack, thinking it's just a minor issue. But a heart attack is not something you can sleep off. It's a medical emergency. Common heart attack symptoms: chest pain or discomfort. This may feel like tightness, pressure, burning, or squeezing. Some describe it as feeling like an elephant is sitting on their chest, pain radiating to other areas. The discomfort often spreads to the left arm, shoulders, back, neck, jaw, or even stomach. Shortness of breath: you may feel like you can't catch your breath, even if you haven't exerted yourself. Cold sweat, profuse sweating, even in a cool room, can be a major warning sign. Dizziness or lightheadedness: you may feel like you're about to pass out. Nausea, vomiting, or heartburn. Some people mistake heart attacks for indigestion. Extreme fatigue, feeling exhausted, weak, or unusually tired. Women may experience slightly different symptoms. They may not have crushing chest pain, but instead report back pain, jaw pain, nausea, or extreme exhaustion. The golden rule: if something feels off and symptoms last for more than a few minutes, do not ignore it. Step number 2, call for emergency help. Don't try to tough it out. The biggest mistake people make: not calling 911 fast enough. Some people feel embarrassed. What if it's nothing? Others think they can just wait it out. But delaying treatment can cause irreversible heart damage or even death. What to say when calling 911? Describe your symptoms clearly. Mention if the pain is constant or comes and goes, if it spreads to other areas, and how long it has lasted. Give your exact location. Time is critical. The paramedics need to find you as quickly as possible. Mention any pre-existing heart conditions. If you have high blood pressure, diabetes, or previous heart issues, this is vital information. Stay on the line. The emergency operator may give you instructions while help is on the way. Even if the pain subsides, you still need medical attention. Some heart attacks come in waves, and the next one could be fatal. Step number 3. Stay calm and get into a safe position. A racing heart increases the strain on your heart, so you need to stay as calm as possible. Sit down in a comfortable position with your back supported. Slightly elevate your upper body to help with breathing. Loosen any tight clothing such as ties, belts, or bras to relieve pressure. Stay where you are. Moving around can worsen the attack. If you feel like you're about to faint, lie on your side to prevent injury from falling. Keep your phone within reach so you can communicate if needed. Step number 4. Take aspirin. It could save your life. Aspirin can slow down a heart attack by preventing blood clots from forming. If you have a 300 milligram aspirin tablet, or close to that dose, chew it instead of swallowing. Why chew instead of swallow? Faster absorption into the bloodstream thins the blood and helps keep arteries open, reduces damage to the heart muscle. Do not take aspirin if you have a known allergy, a bleeding disorder, or if your doctor has previously advised against it. If you're unsure, wait for emergency responders. They'll determine the best course of action. Step number 5. Notify someone nearby. Don't be alone. Call a friend, family member, or neighbor. Send a quick text if speaking is difficult. Have them wait outside for the ambulance so help reaches you faster. Being alone increases fear and anxiety, which can make the situation worse. Having someone nearby provides reassurance and ensures that help arrives quickly. Preventing a heart attack is the best strategy. While knowing how to survive a heart attack is essential, the ultimate goal should be prevention. Heart disease is the leading cause of death worldwide, but the good news is that most heart attacks can be prevented with the right lifestyle choices. A healthy heart starts with daily habits: what you eat, how you move, how you manage stress, and whether you take care of your body. Here are the most effective strategies for reducing your heart attack risk and keeping your heart strong for years to come. Eat heart-healthy foods. Your diet plays a major role in heart health. The wrong foods clog arteries, raise blood pressure, and increase inflammation, all of which contribute to heart attacks. Foods to limit or avoid: saturated and trans fats, found in fried foods, fast food, processed snacks, and margarine. These increase LDL, or bad cholesterol, and promote plaque buildup in arteries. Excess salt: too much sodium raises blood pressure and forces the heart to work harder. Processed foods, canned soups, and fast food contain high amounts of hidden salt. Refined sugars and carbs, white bread, sugary drinks, and pastries contribute to obesity, diabetes, and heart disease. Heart-healthy foods to eat more of: fruits and vegetables, packed with antioxidants, fiber, and vitamins that fight inflammation. Whole grains, oats, brown rice, and whole wheat help regulate cholesterol and blood sugar levels. Healthy fats, avocados, olive oil, nuts, and seeds, support heart function and reduce inflammation. Lean proteins, fish, poultry, beans, and legumes provide essential nutrients without unhealthy fats. Dark chocolate, 85% or higher cocoa, contains flavonoids that help reduce blood pressure. A simple rule to remember: the more natural and unprocessed your food is, the better it is for your heart. Exercise regularly. The heart is a muscle, and just like any muscle, it needs exercise to stay strong. Regular physical activity reduces blood pressure, improves circulation, lowers cholesterol, and helps maintain a healthy weight. How much exercise do you need? 150 minutes of moderate exercise per week, such as brisk walking, cycling, or swimming, or 75 minutes of vigorous activity per week, such as running, HIIT workouts, or sports. Best heart-boosting workouts include cardio exercises like walking, jogging, and cycling, which improve blood flow and strengthen the heart. Strength training with weightlifting or resistance bands helps regulate blood sugar and metabolism. Flexibility exercises like yoga and stretching reduce stress and lower blood pressure. Even small changes add up. Take the stairs, park further away, walk during lunch breaks. The key is to stay active every day. Manage stress. Your heart's worst enemy. Stress is a silent killer. When you're constantly under stress, your body releases cortisol and adrenaline, hormones that increase blood pressure and heart rate. Over time, chronic stress damages arteries and weakens the heart. Best ways to reduce stress include meditation and deep breathing. Just 10 minutes a day can significantly lower blood pressure. Spending time in nature, like walking outside, helps reduce stress hormones and improves mood. Hobbies and relaxation activities such as reading, painting, or playing an instrument can provide a mental break. Connecting with loved ones is essential for mental and emotional well-being. Bonus tip: if you feel overwhelmed, practice box breathing. Inhale for 4 seconds, hold for 4, exhale for 4, hold for 4. Repeat until you feel calmer. Quit smoking and limit alcohol. Smoking is one of the biggest risk factors for heart disease. It damages arteries, raises blood pressure, and increases the risk of heart attacks by 2 to 4 times. Even secondhand smoke is dangerous. Why quitting smoking matters: within 20 minutes of quitting, heart rate and blood pressure begin to drop. After 1 year, the risk of heart disease is cut in half. After 15 years, the risk of heart disease is the same as a non-smoker. Alcohol can also harm the heart, especially in excess. It increases cholesterol, contributes to high blood pressure, and can lead to obesity. Healthy limits for alcohol. Men should have no more than 2 drinks per day. Women should have no more than 1 drink per day. If you smoke, seek professional help to quit. There are medications, support groups, and strategies that can make the process easier. Your heart will thank you. Regular checkups catch problems early. Many heart problems develop silently, without symptoms, until a heart attack strikes. That's why regular checkups are critical. What to monitor: blood pressure. Keep it below 120/80 millimeters of mercury. Cholesterol levels: LDL or bad cholesterol should be low, HDL or good cholesterol should be high. Blood sugar: high blood sugar damages arteries and increases heart disease risk. Weight and BMI: maintaining a healthy weight reduces strain on the heart. If you have a family history of heart disease, ask your doctor about EKG or electrocardiogram, detects heart rhythm problems. Stress tests: checks heart function under physical activity. Coronary calcium scan measures plaque buildup in arteries. Prevention is always easier than treatment. Regular screenings help catch problems before they become life-threatening. Heart attacks don't wait. Your best defense is preparation and prevention. By making small, consistent changes today, you can dramatically lower your risk and ensure that your heart stays strong for years to come. Quick recap: 5 life-saving steps. Recognize the symptoms. Don't ignore chest pain, nausea, or dizziness. Call 911 immediately. The sooner you get help, the better your chances of survival. Stay calm and position yourself correctly. Avoid unnecessary movement. Take aspirin if safe to do so. It helps prevent further clotting. Notify someone nearby. Don't be alone. Take action today. Improve your diet, move your body daily, manage stress, quit smoking, and limit alcohol. Get regular checkups. Subscribe to Healthy every day for more life-saving health tips. Share this guide, it could save a life. Stay informed, proactive, and heart healthy.